Hi, my name is Caitlin Nash, and today I will be showing you how to administer IV medications. IV medications can be one of the most dangerous routes to administer medications because it goes directly into the vein, so the medication travels very quickly to the heart where it can be pumped through systemically through the entire body. So any small error could have a very quick fatal effect. So the first step whenever you're administering medications is to always check the patient's medical record and ensure that the order is there. So you would go, look at the medical record, and then you would pull out whatever medication it is. In this case, we're going to be administering normal saline. So you would check it, make sure you do your 6 rights. So the right patient, the right medication, the right time, the right route, the right documentation. And then you also want to look at your bag, ensure that it's the correct name, look at the color of it, make sure that it's clear, that there's no clouds or sediment inside of it, and check the expiration date to make sure that everything is okay with the IV medication. So next you want to gather the rest of your supplies, which would be your IV tubing. And when you take out your tubing, you want to clamp it so that it's shut, so that when you put the tubing into the bag, that the liquid does not immediately start coming out. So you want to clamp your tubing from the start, make sure that it's not tangled, and you can go ahead and put a label on it at this point. So you would write what's going in it, the time, the rate that you're going to be infusing it into the patient. Then you also are going to want to gather a 10 milliliter normal saline syringe, an alcohol swab, a little cup, and gloves. So we can go ahead and begin. So you want to start by flushing the tubing. So to do that, you're going to take off this cap, take your tubing, again making sure that it's clamped. You're going to take the cap off of this. And this is one of the most important parts, is that the bottom of this bag and the spike on the tubing must be sterile, so they cannot come in contact with your hands at all. And then you're just going to spike the bag by inserting the tubing. And now you can go ahead and hang your bag on what would be your IV pole. So to flush the tubing, you also need to take the cap off of the end of this. So you can go ahead and uncap it. And again, the end of this must remain sterile because it's going to connect directly to the patient's IV port. So now you want to make sure that you have your hand on the clamp, keeping this sterile, and you're going to slowly unlock it. And you want to make sure that when it goes through these Y ports that you invert them to make sure that there's no bubbles. So then after it goes through the Y port, I always like to stop, flick it, make sure that all the air bubbles are out. This is the biggest area that there's going to be air bubbles, and you can see them coming out through this. Okay, and then you can reopen it until the next Y port. And again, I like to stop after the Y port, flick the bubbles, and then this is where the small cup comes in, because a little bit of the liquid is going to come out at the end, but you need to let it go to ensure that all the air bubbles come out at the end. Okay, and you don't want to let a lot of liquid go out because you're losing the amount of milliliters that are going to come out of the bag and go into the patient. But then you just want to check the whole line and make sure that there's no bubbles in it. So there's no bubbles, and then you can go ahead and recap this. So now we're ready to go into the patient room. So all of this has been done with no gloves, outside the patient room, and now this is prepped so that when you go to your patient, you can be as quick as possible. So you're going to go into your patient room, you're going to perform your hand hygiene, put on your gloves, do your 2 patient identifiers. So you're going to go over to the patient, look at their hospital bracelet, their name, their date of birth, and then compare that to the medical record that you have. And now you want to do your 6 rights of medication for your second time right now to make sure, again, just a safety check to ensure that the patient is receiving the right medication. So the next thing that you would do is inspect their IV site. You want to look for clept, so color, leakage, edema, pain, and temperature. So you want to inspect it, feel it, make sure that it's not swelling at all, because all of these could be signs that there's something wrong with the IV site and that it might need to come out. The next step would be to take your alcohol swab and wipe the edge of the lock that's going into their IV. Then you would flush it with 3 milliliters of normal saline using the 10 milliliter syringe that you brought with you. And then you would, keeping that sterile, take the cap off this and then reconnect it into the IV site. And then the last step is to document this. And then you would come back and check the IV site immediately after. In about 5 minutes, you would come back and check it and make sure that there's no complications. So again, we went over all the steps to properly administering medication, ensuring the most important parts that sterility is maintained throughout, especially with the spike, the ends of the bag that you insert the spike into, and then the tip of the tubing to make sure that there will be no complications with your patient. Thank you for listening.